Hello, everyone, and welcome to Health for Naija podcast. My name is Dr. Ngozi Onoha, and today I have a very special guest. I'm really excited to welcome Dr. Tolulope Alugo. Dr. Tolulope, welcome.
Thank you very much, Dr. Onoha. Thank you for having me on your podcast.
Okay, so I'm going to call you Dr. Tolu. Is that okay? All right. So Dr. Tolulope Alugo is a child and adolescent psychiatrist with an interest in youth mental health education. I'm so excited to have you here, Dr. Tolu. So tell us a bit more about you and your work.
So like you said, I'm a child and adolescent psychiatrist, which means I see children between the ages of 4 and 19. And that includes in them for diagnostic assessments, providing education to their parents, and providing treatment. Apart from that, I also really enjoy providing education because I think a very important part of mental health is understanding what affects our mental health. So I'm very big on, promoting healthy mental health in youth as well as in their parents.
I think this is a very important topic, especially during this period of the COVID pandemic. I mean, for most of the last 2 years, we've been in kind of a lockdown state pretty much, and everything has changed as we know it, with more of the physical, social distancing. Our routines have changed and so many changes have occurred during the pandemic. So can you tell me how the pandemic is affecting the mental health of the youth today?
Oh, there's been a huge impact on mental health. In fact, what we're expecting is that after the pandemic begins to taper off, there will be an epidemic, or there is already an epidemic. So we're seeing a lot of numbers increase. Kids are presenting with a lot of anxiety. Because of the lockdowns, people have become very socially awkward. So, you can imagine being homeschooled or doing online learning for weeks or months on end, and then having to go back to a big classroom setting. So social anxiety, kids don't even want people visiting their homes because they're afraid of them becoming unwell or family members getting COVID. So there's that fear. And then also the isolation that comes with all the lockdowns. Kids thrive with all of us, even adults thrive with interacting with every other person. Yes. But when you're in a lockdown, it's just your family you're seeing. We're seeing a lot of teen depression. So depression has increased in numbers, anxiety has increased. One that we were not expecting was eating disorders. I guess when the pandemic first started, everybody wanted to keep fit and maintain a routine. So for some unusual reason that we don't fully understand yet, we have seen an increase in eating disorders during the pandemic. Then abuse. So kids who normally would get a break from a very difficult home situation by being able to go to school are now stuck at home with parents who are also under stress, maybe domestic violence situations, stressful, hostile situations at home. So we're seeing an increase in abusive situations, children exposed to things they shouldn't be because of the general stress of the pandemic and the pressure it's putting on individuals and their parents generally.
Yeah, that's it's quite scary. I think the obesity rates, probably from the just changing routines and maybe just eating excess calories. I think I can speak from my own personal experience. I know during the lockdown, chocolate was one of my favorite snacks. And so I know that a lot of people put on some weight, and not just from being indoors. I think also, like you mentioned, the online schools. So we're sitting down a lot. Even for adults who are working from home, who are sitting down a lot, so less of that physical activity. So I think that might be contributing to the obesity rates as well as stress, So the other question I wanted to ask you, how can patients identify that there's a problem with their child, in terms of seeking help, where to seek help and when to seek help, and what can they do?
Okay. So there are a couple of things. Let's start with basic things. Every parent should endeavor to have a relationship with their child, so that way you know your child's baseline. So if you're beginning to notice that your child, who was previously outgoing, enjoyed having friends over, will be maybe chatting on the internet or going outside to play, is suddenly not doing so, that's a change in functioning. And so you need to begin to keep a closer eye on that and see if you can bring them out of it, just by changing routines. Or you see a change in their eating pattern, in their sleep habits, or generally they just feel like you've noticed that they're just down, they're negative, they're not doing as well in school. Maybe their grades begin to slide. Teachers notice they're not participating as they usually will. So any kind of change in functioning, from the previous baseline should trigger alarms. Now, we've been at this pandemic now for 2 years, so which means that some people's baseline has been really, it's so far away really shifted, exactly. Yeah. But whatever you think is just unusual, so that's first thing, it's observation, and then talk to the child, obviously, depending on what age they are. If they're at the age where you can actually sit them down and say what's going on, talk to their teachers, so seek information, seek to know exactly what they're experiencing, and educate yourself. If there are things that you can change yourself at home in terms of structure, with maybe families eating together, doing activities together, spending one-to-one time with each of these children, those are small changes you can make. And if you notice that those small changes are not really making a difference, then it's time for you to reach out to your healthcare professional. So your family physician, guidance counselors through school, for example. And based on their own assessments, they may then recommend a referral to a specialist. But I believe that before you get to the point of needing to go to a specialist, there are so many other things that we can do before that is needed.
Okay, I think that is very helpful, because so from what I'm hearing is that parents or guardians can identify there's a change in function from baseline, and there's a change in sleeping habits, and there's a change in eating habits. So things they can do is change the routine and eat together. I think that's a very easy thing to accomplish, just sitting and eating together as a family, and just talking to the child and reaching out to say, okay, what's going on, right? And if that doesn't work, then seeking help. But the seeking help, where do they start to seek help? Should parents seek help from the school, or should they go to the primary care provider, healthcare provider, or where should they start?
Well, I think start with easy things. So first of all, maybe talk to the school teacher, find out how the child is doing at school. Do they have friends? Are they isolating from their friends? The teacher might just be able to, tweak things around, maybe sitting arrangements, for example, making sure they have a friend during recess, or get them to go talk to the guidance counselor. That's always a good place to start. And then, if that isn't helping, then go and talk to your primary care provider. So your family physician, for example, your family doctor may also have other strategies, will be able to assess the child in further detail. And these things can happen in combination. You can do both at the same time. Because your family physician may not be privy to what happens in the school setting. So having the school do their own interventions while you're also talking to your primary care provider is also a good strategy.
I think also people worry about stigma. With mental health, there's still very much stigma around it. And what do you suggest as the best way to tackle the stigma surrounding mental health concerns?
I know stigma is a big thing. It's everywhere, but we need to understand that the longer we leave issues untreated, then the more entrenched they become, the prognosis worsen, and the likelihood of things, becoming really difficult to treat gets worse. So I think it's important from that point of view to seek help early and not allow stigma to stop us. And I mean, just the same way, we know that a lot of mental health difficulties are due to chemical imbalances. So the same way you would not hesitate to get help for diabetes or high blood pressure or, God forbid, cancer, is also the same way you shouldn't hesitate to get help for mental health concerns, knowing that not everything is due to a social problem. It could be due to a chemical imbalance. And that's why it's good to intervene early.
I think, I'm kind of a visual person. So the same way is if somebody has a little wound and you want to address that wound, make sure that wound is attended to so that wound doesn't get any worse. But I think, sometimes parents see that a child is not doing very well and they sort of might just keep hoping that things turn around. So at what point should they be seeking help? How long should they wait? If they make some changes, for instance, the child seems to have change in sleep patterns or not eating or eating excessively, and you make one or two changes. How long should you wait before you actually seek help?
I would say seek help early. So I would say within months, because we know that for a child, the brain is developing every day. So unlike adults who's you've had your brain cells develop to a particular point, for a child, a month, 2 months, 6 months is a lifetime. So you don't want to wait too long before things become too difficult to manage. So if you've tried whatever strategy you're doing for 6 to 8 weeks and you're still not seeing a change, then you need to move on to the next level.
Okay, that is really helpful. So about 6 to 8 weeks, and then get help. I think this is such an important topic, especially because you want to, prevention is better than cure. And once some of these abnormal or let me just call them maladaptive behaviors, because a lot of people have had to maladapt to this pandemic. So once these maladaptive behaviors get stuck, it's kind of more difficult to get them to shift, is what I'm hearing. So it's better to intervene a little bit early rather than later, before things come to a head, right? Like a pimple. Exactly. Yeah, okay. Go ahead.
I was just going to say that I like the term maladaptive behaviors, because we know that mental health is on a spectrum. Sometimes when people hear mental health, they get really frightened. That's where the stigma sets in. But when you realize that any emotional health difficulty can start from just, mild dysfunction, changes in functioning, and mental health disorders are really at the severe end of the spectrum. They are not common, so the commoner end of the spectrum is what I like to describe as the walking wounded or the worried well. So which is almost everybody you see on the street or who is beside you at work, who is showing up, they're well dressed, makeup on point, the children look well dressed, but they might have underlying little niggling worries. And that is very common. So when we talk mental health, that's really the severe, rare end of the spectrum, which is not applicable to most of the general population.
Right, because some people may have like a bad day, or they may feel sad. It doesn't mean they're depressed or something they're not happy with, or they may be frustrated, or it doesn't mean they're depressed or they have mental illness, but they just need some help with developing coping skills, which kids really don't have that experience to develop coping skills, or they may not even be aware that something is wrong, right?
True.
Because they may not have the insight. So this was an interesting conversation, and I know you're doing some amazing work in this field. And so where can people find you?
I'm on Instagram at St. John Cap. So I'll just spell that. That's SAINTJOHNCAPP. So that's my Instagram handle, St. John Cap with a double P. Also on Facebook, I have a Facebook page called St. John Cap. My website is under construction, so it will be live soon. On YouTube, I'm also St. John Cap. So if you follow me on any of these channels, I'm regularly posting information on youth mental health. This month, our theme has been attention deficit hyperactivity disorder. So I'm interviewing other colleagues who are working in the field, people who have had lived experience of ADHD, and also I give live webinars. So all that information will be available through any of those channels.
That's really beautiful. I hope to work with you on webinars in the future. And can you just share, before we leave, can you just share one pearl? I usually like to ask the speakers to just share one pearl of wisdom. It could be anything, just random, just for the audience.
Well, just before I share the pearl of wisdom, I wanted to just mention that I'm developing a program called the Emotions Ambassador Program, which is to help raise mental health awareness in children. You know how you spoke about some kids not having awareness or insight?
Yes.
But this will help them understand what their baseline should be, what would help their mental health. So my pearl of wisdom is intentionality. It's important for us to be intentional about our own mental health as parents, because that definitely affects the mental health of our children, and also be intentional about ensuring that your children have optimal mental health. And there's so many things we can do to achieve this.
That is really brilliant. So I want to say thank you so much, Dr. Tolu, for coming on today. I really appreciate the insight. I've really found it very useful. And to follow Dr. Tolu, she is on Instagram, on Facebook, on YouTube. Her handle is at St. John Cap, and I'll spell it SAINTJOHNCAPP. So it will also be in the link in this podcast. And I want to just thank you so much. I really had a great time listening to you and talking to you.
Thank you very much. It's been great being here. I've enjoyed the conversation. Thank you very much, Dr. Noah.
Okay, bye for now.
Bye-bye.